Thank you, Susie. I am pleased to introduce our second CME topic of the day, which is another very important topic at the moment. How do we sustain Idaho physician well-being through COVID-19? We have Dr. Catherine Serio joining us today for this topic. Dr. Serio is a translational behavioral scientist and licensed psychologist. At the University of Pittsburgh Medical Center, Catherine leads a team whose mission is to put health into consumers' hands through digital coaching. The team manages a portfolio of evidence-based digital behavioral health tools and tests new models of health coaching. Serio's work is proving how new care models can improve mental health, access, reduce stigmata, and improve health. Prior to UPMC, Dr. Serio served on the University of Washington faculty and is a product innovator at HealthWise, who we're very familiar with here in Boise. She is a member of the Motivational Interviewing Network of Trainers and a published author. Serio's chapter, The Science and Practice of Health Behavioral Change, appears in the 2016 HIMSS book, Participatory Healthcare, A Person-Centered Approach to Healthcare Transformation. Please help me welcome Dr. Serio.
Thank you, Dr. Williams, and happy Friday afternoon to you all. I am very honored and pleased to be here. Thank you so much to the IMA board for the opportunity to present to you today. I'm just going to work on sharing my screen here and get going. All right. Can everyone see my screen all right? Okay, terrific. Well, when I was honored to have the invitation from the IMA board to speak on the topic of physician well-being, I was both, deeply humbled, but also a little bit terrified, because this is not an easy topic, because physician well-being is probably feels out of reach for a lot of you right now. And so I'm hoping that how I have designed this talk is to create some space for all of you to talk about what you're going through, and then of course to talk about ways to continue to sustain under unbelievably difficult circumstances. So specifically in our agenda today, we're going to cover the impact that COVID-19 has had to you, to your staffs, to your emotional, physical well-being. Really give you a chance to stop and take a moment of pause and inner reflection, because I know how hard all of you work. I know how dedicated you are to service. And often when we are approaching life in that way, it's difficult to make time to take an inventory on how are you doing. So we'll make some space for that today. And then of course, I want to talk about fostering resilience. Lots of folks are talking about that now. It's a very important and timely topic, because we can't stop the siege right now, but we can strengthen you and strengthen your care teams. So where have we been? What has been happening? Just start with this excerpt from the New York Times. And this is about the fear that many people had when they were treating COVID patients, whether or not you were inpatient or outpatient during evaluations. One of the initial fears was a deep terror that you were going to bring this unknown and very threatening virus to your home, to your family. I know when I had my own version of irrationality, I suppose, when COVID first started, and my husband would go into the clinic. He's a family doctor, and he would go into the clinic, and he got home, and I made him, when he got home, strip off all of his clothes in the garage and then go take a shower before he could even greet any of us. So I was afraid, the kids were afraid, we were all so afraid. One doctor in this particular story, the team, the New York Times did, said he dreamed he was surrounded by coughing patients Most physicians have never seen this level of angst and anxiety in their careers. And I think what I want to note is that this was March 2020. So where are we today? Well, these are the Idaho data. You know them well. But as you can see, as we look and take a snapshot over the past year and a few months, when we were all having all of the distress around infecting our families, will we have enough PPE, when will we get the vaccine, and we peaked. But the spike that we're seeing now from Delta is even greater. So we took a workforce, you and the people you work with, and we are now subjecting them to even more pressures and more strains after having been dealing with this for well over a year and a half. So what does the press say today? Just to show you a few things that are out there in our local news. This comes from Canyon County and the St. Alphonsus staff there. And this is from September, that NAMPA is making plans to deal with the COVID surge. The plans included double occupancy rooms, moving patients into non-traditional care areas. You've heard the stories, you've seen it yourself, putting COVID patients down in radiology suites or wherever we can put folks. I know I've talked to leaders in medical leaders across the Treasure Valley area, and they are projecting that their hospitals could be filled entirely with COVID patients. So just to walk us through a few of these quotes, Dr. Hallweger in NAMPA said, "I got into this to save people, and on a daily basis, I'm getting to watch people die, and it's awful." Travis Leach, the president of the NAMPA St. Alphonsus Medical Center, said, "Our political leaders are not only not supporting us, they're actively supporting misinformation." This is from a magazine that was shared with me by Dr. Allen. And this isn't only affecting those of us that have been in practice for a while. The people who are just entering practice are very impacted, of course. So this was a poetry contest that was for the Spokane region and medical students. And this is by Dr. Jacob Hatch, Spokane. And I think it's Dr. Jacob Hatch in Spokane, excuse me. But this is an excerpt from his poem, "I learned the art of patient care while covered head to toe. Sometimes I feel like it's not fair. It could be worse, I know. Please help me breathe," my patients say. Their final supplication. In my heart, I start to pray and set up intubation. I update loved ones on the phone. It fills me with despair to watch a patient die alone when family can't be there. I'd waited for this day for years. I've learned the healer's art. I hold a hand, I hold back tears. I'm glad to do my part. And this was a poem he wrote right after graduating from medical school. Let's go north. This is, all of these excerpts are from the press in the past 30 days. North Idaho pediatric doctors say that the children with COVID are struggling awfully, that they wonder if they are going to die. And what a thing to have that conversation over and over again with children and the parents of children. St. Luke's and the Idaho Capital Sun said, we're seeing the de-evolution of humanity as Idaho's largest hospital system is going through its greatest challenge. Chris Roth, the CEO, said, "We're deeply concerned about our frontline caregivers, and they're just going through hell every day. And then they go out to the community and it's business as usual. Rodeos, fairs, football games, debates in the school boards. So we're living in these two very different realities. And what does that feel like when you go to work and you face the truth of the completely unnecessary deaths, the trauma that causes to those families, to your staff, to yourself. And then you leave and you see areas of the community where people act like we're not still in a pandemic. It is very unsettling. But let's hear from you. I can't tell you anything you don't already know. So I'd like to just take a minute, and we have an online poll. I think Jennifer's going to help administer it. But what I'd like to invite you to do is take a look at these different areas in which you may have been impacted and select the top 3 concerns about how COVID is impacting you or your team. Exhaustion or burnout, depression, anger, unhealthy lifestyle, stop not sleeping well, not exercising, drinking too much alcohol. Number 5 is people leaving the field. Number 6, difficulty recruiting, thinking about, Dr. Jacob and his poem about what it's like to graduate from medical school. And then before you know it, you are thrown into this catastrophic reality that is treating and escorting people to death that didn't need to die. Your own physical health, what this is doing to your own well-being, what you can feel. For some people, the body does keep the score. For some people, that might be having more GI problems. For other people, it could be musculoskeletal pain, the ache that gets worse and worse. But if you choose the top 3, and the last one is loss of purpose. So as folks have started populating these answers, just to reflect back what we're seeing, clearly the number 1 concern is exhaustion and burnout, and followed by anger. And after that, depression, unhealthy lifestyle, and leaving the field. So you know it, you don't need me to read you the headlines, but I did want to take a few minutes and start with that, because I want you to know you're not alone, and your staff is not alone. And what you are absorbing, you're absorbing it in ways that is turning into the sense of burnout or the sense of anger. So unnecessary that people are they're emphasizing their own individual choice, but not doing that in a way that recognizes the impact it has on you and your teams. All right. Well, thank you for taking a moment to do that. We're going to talk about all those things, and we'll go on. And I wanted to say, as I was thinking again about this presentation, I was thinking about, before I got into the work that I do today around digital interventions and new models of care, I started my career teaching physicians at the Family Medicine Residency of Idaho. And I got to see firsthand over the many years I was there what servant leaders you are. It's the culture of medicine that you got into this to serve, to care for people and to care for communities. And I've been trying to imagine what it must feel like to go to work and be faced with people who are verbally, sometimes physically assaulting, and being at the very least disrespectful, at the worst threatening. People have been threatened with lawsuits. People have been threatened with physical assault. And I can't imagine what that has done to you. And I thought about it in history, like in American history, when have we seen something like this before? And the only time I could think of was when the Vietnam vets came back, and there was so much divisiveness in the country about should we have been in that war, but a very, very misguided way of reacting to that uncertainty about our decision to be at that war. Very misguided reaction was to yell at the soldiers when they came back. to call them, baby killers, to throw things at them. And again, when I think about what that must have been like for them, they saw friends die, they killed people themselves, they were away from their families, and to be received by the public the American public that you swore oaths to serve in such difficult ways, it's just so wrong. And I wanted to say that I'm sorry, that should not be happening. And I can only imagine that this is one of the most difficult times in your professional careers. But I think it's more important that we have time to, as I said, talk to each other. So let me just, and Jennifer, how do I close the poll? Oh, I see. Excuse me, it's blocking out. So I was losing where I was, but I've closed it. So let's see a few other stories and then we'll move on to letting you talk to each other. So this is Dr. Carvalho, who was born and raised in Boise, Idaho, did a residency in Idaho and is now a doctor in Caldwell. And you may have heard her story. She put on social media this photograph of herself in tears when she was working overnight in the hospital, and then later wrote an article about it that got a lot of press. But she said specifically that in the past week, she had seen 14 deaths in a week between people between the ages of 25 and 79, all unvaccinated. And before, she said about an hour before she took this photograph of herself when she could barely continue, she had been verbally assaulted by a family member. And that family member said, called her incompetent, threatened physical violence, asked for her license number, and said that he was going to sue for the reason that she would not provide ivermectin. So what does this do to us? Probably heard a lot about moral distress, and there are different types of moral distress. And again, as you sit with these, I just encourage you to think about which, if any, or all you resonate with. So the first is moral constraint distress. And this is when you believe you know the right thing to do, but you can't carry it out. Whether it's being able to intubate someone in a timely way, whether it's being able to get someone in the right setting. And that's not even COVID patients. I know you're struggling for patients who need to be in an ICU for a different reason, but you can't access any beds. So moral constraint, going from the opposite of a state of plenty to a state of deprivation. And you know how to help someone, but you can't get them what you need to. And that's very upsetting and sits with you. Moral uncertainty distress is when there's a course of action, but you don't know, you have two or more options, but they all seem equally bad. And moral conflict distress is, I think, what we just saw with Dr. Carvalho, that the caregiver, in this case, the family member, disagrees with someone on the care team, and it's gotten pretty ugly in terms of the ways they disagree. Moral injury is when you suffer this or exposed to this kind of distress again and again, and it begins to impact your ability to function, as well as your overall health and well-being. I've talked to local leaders as I was preparing for this talk, and as recently as this week, I spoke with a leader who said that they have seen their moral injury rates over the past year go from being in the low teens to the high 30s. And I'd have to imagine that they're even higher than that. The BMA, the British Medical Association, did a study, and they were showing rates of 95% of moral injury. we can't go through this and not be impacted. What about compassion fatigue? This is where, again, as caregivers, you went in to serve, to listen. And when you are faced with people who are challenging you, I've heard stories about people arguing with medical staff that you can't put someone died of COVID on a death certificate. So this creates, when you're in that interpersonal war zone, it's, again, as you already said in the poll, it's exhausting, physically, emotionally, mentally. It cuts into your sense of accomplishment and meaning and work. One of the things I get very concerned about, but it is very common with people who get compassion fatigue, is you begin to isolate. You feel like you can't talk to anyone about what's going on in the front line, what you encountered at work. And that leads to retreat and isolation. And it can even lead to depersonalization, that sense that you can't feel anything. Sometimes you can't even feel what's in your body. You're walking around incredibly numb. So again, this is an opportunity to create space and time for all of you to talk about what the impact has been on you. And with the help of the staff over at the IMA, we're going to put folks in breakout groups of 3 and ask you to spend 10 minutes sharing with each other a story about something you have experienced that's really impacted you. Maybe you still carry it with you. Maybe you're still angry about it. Maybe you're feeling, again, that sense of depression and lack of ability to connect to yourself or others. And just to share with each other a few stories. You'll have 10 minutes. We'll come back in, and then hopefully a few of the groups would be willing to share 1 or 2 stories, because I'm not telling you anything that you aren't experiencing yourself. So let's get you talking to each other. Jennifer, could we get those breakout groups? I think we're starting to pull people back in. Jennifer, do we have those closed, the rooms all closed out yet?
Yep, they just closed.
Okay, awesome. So I guess I'm going to go back to, I need to share the screen again, correct?
Yes.
All right. Well, I'm curious, as everyone comes back in, and we'll have another breakout here in a little bit that's going to be talking about ways to persevere through all of this, taking care of yourselves and others. But I'm curious if 1 or 2 people that participated would want to share a story from the breakout group.
Hey, Kat, it's Patrice.
Oh, hey,
Yeah.
Patrice.
Yeah, we had a small group, but I think one of the discussions was about feeling disrespect for physicians and our profession, and why suddenly it seems that people are so distrustful of science in general, but also the medical profession. And that's disheartening, you know, for all the reasons that I think you did in your presentation, that we went into this to help people not to lie to them, or not to, you know, harm them, or any of the things that it feels like we're being accused of. So that was a piece of our conversation.
Yeah, it's a painful one. Anyone else? Thanks, Patrice.
Jonathan Cree, we talked about vaccination, and Keith was bemoaning the fact that his relatives don't trust him anymore and won't get vaccinated, and telling him that he's full of it. And I shared one rare success of a 34-year-old female who's got a new marriage and wants to get pregnant, and was an anti-vaxxer, and I just told her we had a neonatal death where a child had lungs that weren't developed because of early pregnancy COVID infection. We don't know what COVID is going to do to pregnancies, and it actually changed her mind. So you get the rare success that I don't think people in Idaho realize that until the vaccination rate gets up to 65 or 70%, we're going to have crisis levels of care, and they don't think we're going to reach that, if ever, until the end of next year. So we have this going on for another 15 months at least.
Mhm.
I don't think people realize that.
Well, we seem to be living in alternative realities. Thank you, Jonathan, for the contribution. And depending on the reality that somebody is in, or the particular narrative or story that they're hearing, it seems like it does make sense, I think, for people who are being told that the vaccine is dangerous to them or their child. And so addressing misinformation came up in ours. And another one that came up that was also heartbreaking was I had a resident, Brooke, in my group, and she said, it's really hard to try and recruit people to residencies when they're looking at what folks are saying in the national news about Idaho. So lots of challenges. Anyone else before we go on? All right. Well, you're a resilient lot of people. So let's now talk a little bit about what resilience is. And I liked this this photograph, and resilience is basically a person's ability, or a tree's ability, to adapt to persistent stresses, strains, and threats. And in this case, the tree is still alive. It is still growing, although it has been misshapen. And I think one of the things that I would hope for with resilience of you, your community, and our entire provider workforce, nurses, physicians, MAs, etc., is that resilience won't lead to being permanently physically changed, but really you will begin to bend back in the direction in which you're growing to begin with. But there's a lot of science in this field. It's getting a lot of attention right now. So I want to walk you through the 4 main tenets of how do you build resilience. This is from a particular website called Super Better, but they talk about 4 types of resilience. Mental, making your brain smarter. Physical, making your body smarter. Emotional, which is really around experiencing positive emotions. And social. So as I go through these again, think about which of these you're using, your staff is using or not using, and which you might be interested in trying. So mental resilience, how we adapt to and change, how we adapt to change and manage unpleasant feelings. A few elements of mental resilience are what's going on inside, what is the story we're telling ourselves between our own 2 ears. And that is something that we have control over. And I have to say, this is one that I struggle with and I talk with my friends and colleagues about, because on the one hand, I might be telling myself a story that, this is the beginning of the end, right? This is human nature just at a civil war that is unlike anything we saw, except for the origin Civil War and maybe to some extent the 1960s. And I can get into the space of telling myself, this is just all going to end badly. But the truth is, I don't know that. Yes, there's a lot of problems. These are the most complicated problems I've certainly experienced in my lifetime. I'd be curious to know if others have experienced problems that have been more challenging than this. But what I try and do then is when I catch myself saying, well, this is just the worst, it's the beginning of the end, is to say, I don't know. All I know is what's going on today. And today, I can try and be of help. I can try and be of help to my family, my coworkers, my neighbors. I can try and do something that feels like I'm maintaining that hope, that I'm maintaining some sense of action. So when you're thinking about your own mental resilience, pay attention to the stories you're telling yourself when the drive home at the end of the day. Another part of mental resilience is acknowledging and allowing space for sad emotions. So this is one that it's not comfortable, I think, for us, that folks that are very highly trained and have very active brains. I can say for myself that going to a place where I'm just going to let myself cry, or I'm going to let myself talk about how incredibly sad I am, is not something that I do easily. But I'm fighting with myself if I'm not creating the space to acknowledge that I have things here to grieve. So those are two ideas in the area of mental resilience. What are you telling yourself every day as you go through this? And you also hear it as you listen to your words. What are you saying out loud? And then are you giving yourself a little time to let your body feel everything that it's been absorbing? What about physical resilience? So again, as folks who spend a lot of time intellectually in our heads, I just wonder if you take a moment now as I walk through this to ask yourself, what is my body telling me about how I am right now? What are your signs and symptoms that you're carrying a lot? For some, it's pain. For some, it's fatigue. For some, it's irritable bowel. For some, it's headaches. I had a colleague who told me, she used to have migraines. They were under good control. And then she had a weekend where she had, boom, 1, 2, 3 of them. So what is your body telling you? So first pay attention, and then think about how you might build some physical hardiness. You know all the things you tell them to your patients all the time. So that's not my question is, what are those things? My question is, how are you using them? Of course, we mean exercise, we mean sleep, we mean a healthy diet. What are you doing to take care of your body? Some deep breathing into those areas of stress. And ultimately, how do we recondition our relaxation response? So you know this well too. We have our sympathetic nervous system that says, danger, danger, get going. And I would say it's pretty safe to say that all of you, most of you, and most of the people you work with have been in a chronic state of alert. So what can we do to strengthen our physical resilience when we're in a constant state of alert, an overactive sympathetic nervous system? We do things to activate the parasympathetic nervous system. Deep breathing, meditation, a bath, a walk in nature. The Japanese call it nature bathing, when you go for a walk outside. Are you creating the space to let your body come down from the way it is running on all cylinders all the time? So that's physical resilience. Emotional resilience. How do we foster positive emotions and surrender things that are beyond our own control? So There are many things that do help us with cultivating positive emotions. Practices of gratitude. I'm a cancer survivor, and when I was going through my chemotherapy and later my radiation, was every night before I went to bed, I had a little journal and I would write down something that I was grateful for that happened that day. What are we doing to cultivate an interest? I have a colleague a physician colleague who decided that she needed, something to focus on that wasn't, and this came up from Brooke in our breakout session, that there's so much conversation about COVID, we want to talk about something else. Well, if you have an interest, and my colleague said she wanted to learn how to play the ukulele, and she put her attention deeply into it, doing online classes, joining a group, then imagine you're taking your attention and you're putting it someplace else to develop a new skill. So playing an instrument, painting rocks, spirituality is a huge piece of this. To being able to surrender the things we cannot control. So what are you doing to cultivate positive emotions? And thinking on that theme of cultivating positive emotions, don't lose sight of all the lives you've changed. I started the presentation by talking about, again, what you already know, that there's a lot of hostility out there and a lot of misinformation. But can you give attention to the lives that you are still touching, the ones you've touched in the past and the ones you'll touch in the future? And I'm going to share a video thanks to Patrice. She found this for us. So hopefully this will work. We tested it. Hang on one second. Just to get you thinking on this theme. Can folks see my YouTube? And I can't see you. So if somebody can just say yes.
No, we can't see it.
Not yet? Okay. I think I have to change my share screen. Thank you for your patience while I switch to the other. Oopsies, that's not going to be what I need. All right. How about this? All right. If someone could tell me now if they're seeing YouTube.
Yes.
Terrific. I'm going to start playing it. If you can't hear it, let me know and I'll stop it. It's about a 3-minute video.
Hi, I'm Mr. Ballou, Coach Ballou.
My name is Mrs. Hall.
My name is Mr. Smith.
Soy Melissa Soto. My name is Ms. Coy. You never turn it off. We become a family, and they are my kids.
I've been called a lot of things from the mouths of 10 and 11 and 12-year-olds.
I also tell them, sometimes you're in school longer than you're actually at home.
Yeah.
And I tell them the same thing. I spend more time with you than I spend with my own family.
When I get into this space where it's like they're my kids, and then if they make a mistake, which they will do, I get doubtful, like, am I making a difference?
You have those times where you kind of wonder, why am I exerting all this energy and this effort? And I did get that doubt sometimes.
I don't know any teacher in my life that made a difference in which I go, that was a great lesson. I think about the ones that made a difference to me as a person. And so when they mess up, the perfectionist in me takes it very personal. Give me 1 second.
What? Are you kidding me?
Oh, snap. A to the J.
Dear Miss Coy, I came into 5th grade as a shy girl who especially struggled with talking in front of people.
You took an interest in the things that were important to me, always asking about my family and showing interest in my love for baseball.
Because of your teaching, you have inspired me to do whatever my passion is when I grow up.
Winning at all costs. That's every coach's motto. What made you more unique
was that you didn't care about the wins. You wanted us to be better individuals day by day.
I remember whenever I got stuck in a problem and I thought I just couldn't do it, you said, it's not that I couldn't do it, I just couldn't do it yet.
Tú eres mi favorito, maestra, pero yo sé que hablas inglés.
Thank you for making the past year great, and I can't wait to spend the next 8 months with you.
Thanks for being the man and for being a great teacher. Your boy, A to the J.
A to the J.
Thank you for making me a better person, and thank you for never giving up on me and helping me become the man I am today. Love, Daniel.
Hey, Coach. What's up, Coach? We appreciate your dedication and effort you put towards us. We thank you for not just making us better basketball players, but better men. This is for you.
Thank you, Coach.
My gosh, man.
It's good to see you. Congratulations.
So proud of you. I'm so proud of you.
Family on three. 1, 2, 3. Family. Here you go.
All right. So I hope that got you all thinking about impact that you have and you have had and you will have. And I'm thinking for the sake of time, Jennifer, would we be able to go into that second breakout room just for 5 minutes? In the second breakout room, it's just an opportunity for you to share out loud with a few other colleagues what you think would be resilient strategies you can bring into your life or with your staff.
Yeah, we can do that. We just might not have time for Q&A.
Yeah. All right, let's just give them 3 minutes.
Okay, sounds good. I'll
Thank
send you guys. Do you want me to send them now?
Yes, please.
Okay.
All right. Well, for the sake of time, I know we need to wind up, but I'm going to just say 2 things. And then if it's all right, I want to give Steve Reams just a couple of minutes. I appreciate that might get into the Q&A, but I'm happy to talk to people offline at another time. Because I was concerned about time, I skipped ahead and didn't talk about the 4th piece. Can everyone see my slides again that says social resilience?
Yes.
Okay, great. Well, this is how we support and help each other. And this is exactly what came up when I was talking with Brandon in our breakout. But I will just say 3 examples really quickly for you to keep thinking about. One is accident solidarity. If you have not heard the story of Dr. Krell in Idaho Falls, he came into the shift one day and everybody was pretty burnt out, and he just found a whiteboard and he wrote, "In the end, what sustains us and what we will remember about having survived this madness are the remarkable people who endured this with us, the best of humanity, all of us who demonstrated the best of our calling. We endured this together. We supported each other. We saved lives. We lost lives. We did it with compassion and competence. We will not forget this." So random acts of kindness and solidarity. Take time to celebrate. I had to share this one because this was from a lovely birthday celebration I had with my friend, Dr. Burgess. And Dr. Burgess, I did choose the color scheme of the slide presentation in honor of the Vandals. And the last is collective action. And this is when you come together to do something. It's very powerful when you're feeling otherwise powerless. And I will say that one of the things that I have done is, and I use the example here because it's a pretty powerful one about what happened with Idaho. You're very familiar with it, Idaho, Medicaid expansion. And this was an effort that was involving so many people from so many walks of life and different political opinions. Christy Perry, a Republican and gun store owner, was one of the leaders of the Medicaid expansion. So what might we do together to feel that solidarity? Can you guys still see me on video, just out of curiosity?
Yes.
Yes.
Okay, I'll show you this and then I'll hand it to Steve and see the rest of the time. But this is what I ordered from Etsy. Can you guys see that?
Yes.
So it's another way to say collectively, let's take care of each other. Steve, would you mind talking about the Physician Vitality Program?
Actually, I'm going to defer to Dr. Hahn, and I'm just going to post a link to our website if anybody wants to reach me and ask any questions. I know we're running into her time, so I'd just like to cede my time to her if that's okay. But thank you.
Absolutely. All right. Thank you all for the opportunity to talk to you, and I'm sure you'll have a wonderful presentation from Dr. Hahn.